Hello, my name is Nicholas Fahed. The title of this presentation is The Case for Universal Healthcare in the United States. The purpose is to convey the need for and the benefits of a single-payer universal healthcare system in the U.S. in hopes that we can achieve healthcare coverage for all citizens. While most industrialized nations in the world provide some form of universal healthcare to their citizens as a basic right, in the U.S., the number of citizens who do not have access to healthcare is at an all-time high. This lack of basic medical care for all Americans is a profoundly ethical problem that could be resolved if the U.S. government adopted a universal healthcare system that would ensure that all citizens have access regardless of employment or economic status. According to the most recent figures, the number of uninsured Americans has risen significantly in the last decade. At a time when healthcare costs are soaring and jobless claims are increasing rapidly due to the pandemic, far too many Americans who could once afford the protection of healthcare now find themselves at a serious medical event away from bankruptcy. As Chuck Pagano once said, "If you don't have your health, you don't have anything." For many Americans, the prospect of getting sick can mean losing everything. Statistics show that rising healthcare costs in the last decade are pricing people out of adequate healthcare coverage. In the last 5 years, the cost of health insurance premiums has gone up by 2 to 3 times the rate of inflation. Working class people can barely afford private insurance plan and have to rely on employer-based insurance. Because of increased healthcare costs, however, the percentage of employers offering the workers health insurance is also dropping. Businesses either can't afford to provide health insurance or they pass along such a large portion of the monthly costs that it makes it too expensive for the most people. Too often, employers offer high deductible insurances that only cover a fraction of what patients would have paid in healthcare costs. Opponents of universal healthcare argue that the cost of covering all citizens would be too great, but having so many uninsured Americans has a hidden cost that people don't realize. Uninsured people are 3 times less likely to seek medical care unless it's an emergency. By delaying a medical diagnosis, the uninsured are twice as likely to have serious complications from chronic and acute diseases. Because the uninsured can't afford regular doctor visits, they rely on going to emergency rooms for their health care, where the costs are 5 times greater. So who pays for the emergency room visits of uninsured patients? The answer is, we all do. Uncompensated care costs refer to the expenses that hospitals incur when they treat patients who are not insured and can't afford to pay. Those costs are passed along to everyone. It is obvious that there is a huge need for healthcare reform that can address some of these needs. But what can be done? The current healthcare system must shift to a single-payer universal healthcare system that would ensure everyone is covered while helping to reduce unnecessary costs. People who are in favor of universal healthcare argue that we already have successful government-funded healthcare systems. It would just be a matter of expanding those. Currently, citizens over 65 years old take advantage of Medicare, and low-income individuals qualify for Medicaid. Military veterans are provided health care by the Office of Veterans Affairs, and members of Congress receive the Federal Employee Health Benefits Plan. All of these are existing government programs that provide effective care for their patients. If it can work for them, shouldn't it work for others? According to policy studies, in order to be successful, a shift toward universal healthcare would have to go hand in hand with cost controls. Covering everyone would cost more money, but having a single-payer system would save far more money in the long run. A single-payer system would eliminate the inefficiency that makes our current healthcare system among the most expensive in the world. It would drastically reduce the administrative and overhead costs that private insurers pass along to the patients. It would also promote pharmaceutical price negotiations so that medication would cost less for consumers. Under a single-payer plan, administrative and prescription drug costs would be cut significantly. The U.S. healthcare system is 18% of the economy. Making a change like this would be a big deal. For some people out there, they are content with the current healthcare plan. So what's in it for them? Instituting a universal healthcare program would ensure that the country has a healthier population, which would lead to a more healthy and productive economy. Citizens would be much more likely to go to regular checkups and practice preventative care and take better care of themselves, which would result in a healthier quality of life. The financial system would also gain a lot, as the cost of savings for businesses and increased productivity of healthier people would stimulate the economy. No longer bound to an employer for health insurance, employees could take risks and open new businesses, which would stimulate the economic growth. This speech has outlined the needs, proposed a solution, and painted the picture of what the benefits could be. Now, what can one person do to help realize this goal? The lack of basic medical care for all Americans could be resolved if the U.S. government ensured all citizens would have access regardless of employment or economic status. The way to achieve this goal is to let your voice be heard by your legislative representatives. Write an email or make a call to your member of Congress and the senators in Washington. They need to hear from their constituents that the issue of healthcare is a moral necessity that would ensure a brighter future for our country. America is too great a country to settle for second-rate healthcare systems that only benefit those with money. A universal healthcare plan would truly be the high tide that raises all ships. Thank you.